Hey everyone, it's Dr. J with Dental Masters of Alexandria, and aging affects every part of your body, including your teeth and your gums. Understanding the normal changes that occur throughout your life can help you maintain good oral health as these changes start to take place and you age. Part 3 is young adulthood, which is typically ages 20 to 40 years of age. And some of the things that we consider are oral hygiene challenges. So at this point in everybody's lives, everybody's pretty busy typically, whether it's college, a new job, and staying frequent to going to your dental professional visits can be often difficult. So it's important that you stay with that. Also, this is where we see people's dental hygiene typically trend down a little bit, meaning that they may stop flossing as regular flossing. So it's really important that we pay attention to oral hygiene challenges. The other thing during this age of between 20 and 40 is we still see a lot of people that have had wisdom teeth that maybe came in a little bit later, or they weren't taken out during your summer vacation, during high school or college years. So this is the time that if there's a wisdom tooth that needs to come out, to take it out, because as you get older, the bone heals differently, it heals slower, and sometimes the process can be more uncomfortable after. And by the way, for a wisdom tooth that needs to come out, there is certain types of criteria that we look for. If the wisdom tooth is in the mouth partially, and it can be the cause of an infection, we call that pericoronitis, or basically an infection of the gum around the tooth. It can become actually a major problem. Or if the tooth is leaning on the molar in front of it, then it can cause damage to that. So we want to get rid of those so that they don't damage the tooth in front of it or create an infection that's going to disrupt your life. And then also 20 to 40, we start to see cosmetic concerns. A lot of young adults will come to us seeking cosmetic care, whether it's bleaching, possibly veneers. Just had somebody come in yesterday for veneers, and it's something that we see very frequent to try to improve their smiles. So some tips and risks for this age, young adulthood, ages 20 to 40. Again, let's make sure that you're getting to your dentist. If you happen to be on the move, you're moving, find a dentist, ask a friend or a family member for a referral, but find someone that you feel comfortable so that you can get in for your twice a year cleanings, and for some people more. And then also make sure that you get good instruction, whether it be on the internet. You can watch my videos, go to your dentist app, so you know how to properly floss your teeth, brush, and if you need any special adjunct or maybe an electronic toothbrush or a water pick, anything that can really help prevent cavities at this time. So oral home care instruction from your dentist and regular visits, really, really important. One other thing we want to talk about in the tips section here is very often this is where we see people start to exhibit signs of bruxism or clenching. So bruxism basically is a grinding of the teeth, clenching is squeezing of the teeth, and these habits sometimes are related to your bite, sometimes they're related to brainwave activity or stress, and sometimes it's a combination of both. That's a whole nother video. But in any event, you want to make sure that you're talking about this with your dentist so that they can look and evaluate and see if you possibly might need a night guard, so that if you are clenching or squeezing or grinding your teeth in the evening, you're at least protecting them and also potentially preventing any TMJ or temporomandibular disorder. So that's pain or any structural problems in the joint or muscles that could also be a long-term issue if not treated at this time. So hopefully this was helpful. I know, again, a lot of information. The take home about this is oral home care and making sure that you're aware of if you're clenching, grinding your teeth, and also the cosmetic piece to really take a look at that and see if you're somebody that wants to do something about that. So thank you for watching part 3 of our 5-part series of the life cycle of your teeth, and look forward to seeing you on part 4.